Fashioned paper.
Check, check. Check, check. Check, check.
Check, check.
Check, check. Check, check.
Those of you on Teams, can you hear us?
Check, check.
I can now.
Yep.
Can someone on Teams speak to me so we can see if we can hear you?
Can you hear me?
Here and there. Every minute I can. Should we? Yeah, yeah. I think we should because time. So, is everyone okay? Are you guys okay to keep working? And okay, Michelle. Okay, just as part of board education tonight on the agenda before we officially start, we are covering draft budget for fiscal 7. So I'll turn the time over to you, Michelle.
Thank you so much for letting me take it. Uploaded. I just added so we're off of the anyway, just to give you a little backstory on this budget. Steve, Bill, and I met with the director and came up with the revenue and budget. Very conservative approach across all. Working? Really? Okay. Is that better? Okay. Okay. So this is the agenda tonight, and I'm going to start on operating revenue. So like I said before, the inpatient and outpatient revenues are based on statistical projections derived from actual data provided by department directors. We included no rate or price increases in the budget because our fee schedule is already a little high. And this Meridian recently, and that rate came back as $5,400. And Bailey actually calculated our per diem rate at 4,036. It's a significant difference, and with this budget, I kept it to take the conservative approach. I based it on the lower rate because we are probably, or not probably, we are definitely going to have to pay the overpayment back in November. So it's good for cash flow right now, but we're going to have to pay it back in November. So I'm going to work with our new auditor, CLA, and they are going to help me come up with what that is going to be in November so we can plan for it moving forward. So the allowances decreased due to CAW designation. And then we also added retail pharmacy for long-term care. So you can go to the next slide. Okay, so salaries and wages. We have budgeted 200 FTEs. We currently have 190. We included a 1% wage increase just to keep up with inflation. The employee benefits increased just due to extra staffing. And the Wyoming retirement employer contribution is going to increase from 9.37% to 9.6% starting in July. Next slide, please. Okay, so moving on to more of the expenses. So professional fees. No, I'm going to talk about that at the end. Yep. Yep. Thanks, Rex. Oh, you're fine. Don't worry. Okay, so professional fees, there's a reduction due to transitioning executive leadership from health tech contracts, the CEO, hopefully soon a CFO and a CNO. Contract physicians also decreased due to Apogee and ARC contracts. Increase in supplies, primarily driven by higher dietary food costs. Maintenance and repairs also increased due to service agreements for the new hospital equipment. We received a first-year grace period for that equipment. Next. Okay, so the interest reflects interest on Series A and B bonds and the line of credit. Principal payments deferred for 2 years. Contract labor decreased due to reduced reliance on travelers as nursing positions are filled in the LTC and the CAW. What else? So depreciation also increased just because it's a full year impact for the new building and equipment. Okay, non-operating revenue. Okay, I think my mic actually works now. Thank you. So the mill levy income is expected to increase by approximately 14%. I took the conservative route and estimated a 10% increase. The final valuations will be ready on June 1st. So what else? So there is a 1.4 million decline related to the completed construction project, so no further ARPA or foundation MRI funds available. Next slide, Jan. Okay, so this is just an overall overview of everything. So the net operating revenue is 30 million, operating loss 11.9 million, net income negative 4.6 million, largely offset by the mill levy support. The EBITDA is 1.5 million, which of course excludes 6.2 million of depreciation. Next slide, Jan. Okay, so I just wanted to go over the next step. So I am going to submit the draft budget to Wyoming Department of Audit and the commissioners at the end of this month, and then the final is due at the end of June. Well, actually, so we're going to approve it in June. It's really not due at the state until the end of July. But at next board meeting, we will present the final budget to you for final approval. So if you could go to the next slide, Jan. So As I said before, so this budget was created by Steve, Bill, and I. And so now that Rex is on board, we are going to work on tweaking it a little before the final comes out next month. So these are the things we are going to look into and figure out exactly how it will impact the budget. So we are going to add the swing bed program, the 340B program timing, the Rural Health Transformation Grant, Senior Life Solutions, and we will hopefully convert to an RHC. So there's a lot of changes that we are going to incorporate. So it'll look a little different next month, but we will go over that with you and see what it looks like. I'm definitely going to have our new auditors help me figure that out, and also health tech maybe if they're willing to help, because I don't know what this really looks like and how it will impact our reimbursement. And then also another change, which will really just affect the expenses, is we are going to change the Apogee contract. And so with that, we're not going to be hiring as many providers as planned and just extend the Apogee contract, but with some changes. So, yeah, any questions? I know that was kind of a lot. Yep. So I'll post it for next month. So if the board approves this proposed draft budget, on that actually states when the final budget will be held. And so if you're okay with it, and then I will post it in the paper 3 times, and then we'll get it approved next month. So just during the regular scheduled board meeting.
I don't really have any questions, but I think I mentioned this in Finance Committee. I'm really excited about the potential contribution to reserves that you're. That's very exciting.
Yeah, me too. With these changes, it will impact it even more significantly. So.
I appreciate the conservative approach too. It's helpful.
Yeah. No, I think that's it.
Thank you for putting it together.
You're welcome.
Yeah, I appreciate all the work that went into it, Michelle.
You're welcome.
I know it's a significant amount of work. Okay, any other questions? Okay, you did it with time to spare.
I know, I'm impressed.
Right. Thank you, Michelle. I should ensure that Ashley doesn't have any questions. Ashley, do you have any questions about the draft budget for Michelle?
I'm good for now, Madam Chair. Thank you. Can you hear me?
Yeah, I'm sorry, Ashley. We can't hear you. Can you type them in the chat, maybe?
No questions for me right now. Thank you.
Okay, thank you, Ashley. Sorry, everyone on Teams. We're still just having some audio issues we're working on. Okay, anybody need we start officially?
Well, Michelle, you said if we are good with the proposed draft, then you'll go ahead and post it. And that, do you need an action from us?
It's on the agenda.
Okay, I was just making sure it wasn't tied to this. You're welcome.
Thank you, Michelle. Ashley, can you speak to me now so we can see if we can hear you?
Yeah, can you guys hear me now?
Just through your computer.
Can anybody else on
Okay,
Teams hear
We'll
me?
keep trying. Thank you.
I can hear you on Teams.
Okay, thanks, Dr. Hasty.
Right. Thank you. Yes, I'll be in touch very soon. Actually 6 p.m. So we can go ahead and call this meeting to order, which I'd like to do. I'd like to welcome everyone and ask you to join me in the Pledge of Allegiance, please. All right. Thank you, everyone, for being here this evening. I'm going to try to make a concerted effort to speak into this mic. We have a fairly full agenda for the night. First item is to set the agenda. So I don't have any additions or changes myself. Does anyone else have any to offer? Correct? Anything? Okay. With that, I will ask for a motion to set the agenda then, please.
Madam Chair, I would move to.
Thank you, Kenda. We have a motion
I'll second.
and a second. All in favor, please signify so.
Aye.
Any opposed? Thanks, Ashley. All right, motion carries. Okay, next item on the agenda this evening is consent agenda. And we only have meeting minutes from 2 meetings, the April 15th, 26 special board meeting and April 22nd regular board meeting. Has everyone had an opportunity to review those minutes?
Yes.
Any questions, or would you like to take action?
Madam Chair, I would move to approve the meeting minutes for April 15th, 2026, 2nd, 2026 to executive session minutes.
Thank you. We have a motion
I'll second.
and a second. All right. Any other questions, concerns? On the motion to approve the minutes from the 2 meetings and executive session as set forth, please say aye. All those in favor? Any opposed? Gotcha, Ashley. Thank you. Motion carries. All right, that brings us to public comment. So I'll open up the floor for anyone on Teams or in the room to speak to us tonight. Yes, Dr. Burnett.
Madam, is this on? I guess it is. I would just like to give a public shout out to PJ Mary. Outstanding job he's done, the service that he's provided, and the position he's left us in upon his departure. And we'll just wish him the best. I'd also like to give a shout out to the provider staff that has stepped up in recent times to fill voids in the schedule, particularly Dr. McLaren and Ryan Grove and their staff. Just want to say thank you publicly.
Thank you, Dr. Burnett. I would second that. So, anyone else? Yes, Ashley, can you speak again to us? Try one more time.
Can you hear me?
Yes, yay. Okay,
Yay.
we're up and running.
Okay, great.
Perfect. Thanks, gentlemen. Okay. Thank you. All right. Any other public comments? Anyone on Teams? Okay, we'll move on. Next item on the agenda is committee reports. First item under committee reports is building committee. I'm pleased to say that we are just about to the end of building committee, working on closure of our USDA loan, hopefully within the next 15 days. We had a final inspection by the USDA team today. And that's about all I have to report. Lena, unless you'd like to add anything.
No, just a couple of things found on the inspection today, but nothing big, and all things that Leighton is going to address.
Okay, thank you. Any questions about construction, building? Okay, we will move on then. Sublette County Health Foundation, Carrie.
Yeah, there we go. Great. Okay. I have uploaded 2 spreadsheets into the foundation tab. One of them is called construction project. So it's everything over the life of the USDA project that we've done in the past 2 to 3 years. It totals to a contribution of 4.6 million with the additional 1 million from Mr. Ricketts. So almost 6 million total. And then we closed that spreadsheet. So that's done. It says final in there, but you guys have our record of it, which is a relief. So, and then I started a 2026 spreadsheet, which is the projects the foundation's working on this year. That includes the dormitories, which are complete, the bladder scanner for the Heritage Home. The IT project is in progress. Catherine Briggs donated $5,000 for a hot food table for the Heritage Home so they could serve family style meals and not have to tray as many things. And so we're spending that donation. And then last month, you guys approved the microbiology equipment for $40,000. So that's all in there. We still have $103,000 to spend on the nurse call, which is in there as well. We have $53,000 dedicated to the surgery suites. And then we're still holding the $100,000 donation from Jonah Energy, plus the $166,000 we put in for the ambulance. So the ambulance should arrive at some point, and we will pay for it. And then the SLIB board meeting for the next ambulance is on June 18th, and Rex is going to go attend that and talk to the SLIB board about our next ambulance. You remember you have 6 ambulances, and 2 were still from 2012. So this will complete that and get the whole fleet into the 2020s, which will be great. The artwork is still there. The art committee's meeting tomorrow to finalize that, and we'll shift the artwork in July, which will be great. There's a lot of excitement around that. And then the assisted living feasibility study we approved last month was the $200,000. Dawn and I met with Marilyn Jensen, and she was thrilled that we were sort of replacing the interest, so to speak. And so she was happy with that. She thought that was great. She was good with spending her $600,000 donation towards assisted living. At the last foundation board meeting, Rex asked us to hold off for 30 days. And he said, wait, he said, you guys may want to do a feasibility study on assisted living and surgery, or we could see, or we could change directions. Ashley pointed out we should probably protect Marilyn's feelings at this point, since we already did have that conversation, but we're holding off and waiting direction from Rex. So the stained glass is ready to be ordered, which is great. They found an app where you can download the design into the app, and it tells you how much glass of each color you need. So we saved a bunch of money. I'll have the exact amount next month. And their goal is to have the stained glass in the sanctuary by August 4th, which is the 1-year anniversary. So that's a nice deadline. Let's see, I already mentioned Brex is going to the SLIB board, and then the events this summer are YO Gives. The foundation board said, since we're not sure about assisted living, to make it support the hospital, sort of just general support healthcare, better healthcare. So we'll launch YO Gives, and then we're holding off on having boots and scrubs until we know more, though we are starting to see donations roll in. So we'll have to kind of figure out if we're doing a fundraiser this summer. But we'd penciled in August 6th right here on the street, actually. but we might switch directions. So, and then Foundation 23 will be in September. So I think that's my report. You guys have any questions? Great.
No questions. I think this is a great place. We are adding closing construction just to say thanks to the foundation for all the hard work. And yeah, it's pretty phenomenal, the amount of money raised. So great. Thank you. Share our thanks with the foundation. Okay, thank you, Carrie. Next item on the agenda is Finance Committee. So I'll turn the time over to.
Does this sound okay? Okay. So I'll go through the notes and then we'll kind of go through the financials maybe a little deeper, but revenues were down for the month of April. Basically in all departments, lab was up and skilled nursing facility was up. So you can see from the charts that, it is a bit concerning. I understand, the busy season probably starts here before long, but we're down in basically all areas of operations. So we'll keep working that, and I know we've got some plans. Maybe, I know Carrie's planning on some marketing things, and we'll just make sure we're communicating with the physicians. The contractuals continue to be a concern. We still haven't got an answer. I think last month we heard that we had 95% write-off. So we're still trying to work through that. It sounds like it has something to do with either, that we were a PPS hospital, but those rates are still way too high, that allowance and the adjustments. So my gut tells me that Noridian doesn't understand how to pay properly. So we did have a long conversation, Michelle and myself, with Hyde Bailey today, and they've been really gracious since they're no longer our auditor of record. But we'll get to the bottom of it, and you'll probably see a pretty big adjustment the other direction probably in June or July. So I did make a call on that situation again to Noridian. We also, and Teresa Haddock, who you've already met, we unfortunately, whether it's technology or other things, it happens to us, it seems like. So you have to get a PTAN number. Is it PTAN or PCAN? PTAN? For your PPS hospital, and then we had to get one when we became critical access. And unfortunately, our date for going critical access was the 26th of February. Our PTAN for PPS is dated the 27th of February. So we're basically in two programs at the same time. And so we dropped $900,000, almost $900,000 worth of claims 2 weeks ago tomorrow. Our friends at Ochin worked over through the night so we could drop the claims, and certainly Teresa and her team worked really hard. Got all those out the door, but they can't be processed because they're hung up because of this PTAN thing. And I think Dominique said in one of our meetings earlier, there's probably not a bigger issue facing us right now than getting that cleaned up. And it seems like it's a bureaucratic mistake. The date was put in. It could even have been the 26th, both dates, and we'd have been fine. But putting the PPS one at the 27th caused us to be in two programs at the same time, which is not okay. So it seems like you could just go into the computer, change the date, and move on. But I know Noridian said they were going to have to get a team together, and it's 3 or 4 people. And so again, I called my contact I had at Rollins. He told me not to really bug him because he got in trouble last time I kept bothering him. But this is a big enough issue, whether it's him or somebody else, it needs to get fixed. So anything you want to add, Teresa?
We do have a bunch of claims that went out for the CAW, for the critical access, that we do expect to hit the payment floor either tomorrow or Friday. So we're hoping for some good cash to come in. That was the $887,000 that we billed. That's gross charges. So we do, we hope in the morning we'll have some good news.
Good news would be great.
Yeah, we're excited. We see that they've hit the processing. They're in suspense. None of them are kicking back, so we expect them all to go through. So we're excited. No.
Going forward, okay. All Well, thanks. So a lot of work has went into that, and it's obviously really good news. So any questions of Teresa? Revenue cycle has been our big focus, at least the 5 weeks I've been here. So all hands on deck, and certainly Health Tech has helped us. We're having revenue cycle meetings with Ochin weekly. We're having billing meetings weekly with Ochin. We're having a finance huddle meeting with Health Tech weekly. So, I mean, making sure that, we don't have gaps, we're not duplicating, we're not missing stuff, so that we can get this thing turning freely like it needs to turn. In the next few months or couple months, we'll have Teresa come and talk about revenue cycle, because we talk about it in these big terms, and there's like 13 pieces, and if one of them's not turning at the same speed, it slows the other parts down. So, I didn't understand until I was at Rollins how important revenue cycle is, and cash truly is king. So we got to give great care, but we also have to be able to collect for it too. So anything else you want to add? Okay. So contractuals were, we wrote off a bunch of legacy AR, and I know we're going to be talking tomorrow about who authorizes write-offs, and make sure that there's a process associated with that. But balance in the legacy AR is down to 189,000. Is that right? 138. So what we want to know is how much of that was actually written off, and so we'll have those numbers. It was, according to her notes here, 2.3 million 6 months ago. So at least we're getting it off the books. Bad debt, that's why it was up, is because we cleared down a bunch of AR, and if we've done things properly, then a lot of that can flow through the cost report, and I think we have, so that will be helpful on the cost report. Net patient revenue, because of the contractual adjustments, are under $1 million, which is a little concerning at $900,000, but I think you're going to see a bump in a couple, 3 months with contractuals getting reversed, so that will help us down the road and then true things up. So does that make sense? Operating income or expenses, professional fees were over about $124,000. There's a lot of good, I think, information, or at least good things happening on the expense side of the equation. I think we were only over on 3 areas. So, and the ones that have the most impact, salaries, and some of the other ones we were in better shape. But professional fees were up. We had some payments to I. Bailey for that study that was done on rural health clinics versus federally qualified rural health clinics. And I think we had some late payments. And so hopefully, our accounts payable on the good side is pretty current compared to most places I've been lately. So problem is when your payables, and you guys understand this, payables start aging, then it gets harder and harder to get the day's cash on hand up because you're paying off old stuff. So we've done a really good job here, I think, of keeping the payables fairly current. So I think she said we had $300,000 behind. So when you're looking at days, that's not much. So that, from a board perspective, is encouraging. Our contract physicians, I think she said, we're up. We sometimes receive invoices fairly late from our hospitalist group. So we're trying, in fact, we had a call today to kind of make sure those are coming in right, and then we'll talk a little bit later about some things we're doing on that stage, I guess. And then we had some maintenance and repair overages due to the dormitory remodeling that was done, and then we had some other building repairs that were done. So, on the good news, our gross days are starting to come down a little bit. They're still way too high. They're trying to get things trued up with Meridian on the PPS rates and the critical access hospital billings. EBITDA is up a little bit from March. We only had a loss of $964,000, and then our bottom line is 1.4, and I think it was 2.3 last month as a loss. So when you compare March to April, and going forward, I talked to Michelle, I don't know where my notes are exactly, but we're going to start sending you financials so you compare the previous month, and then we'll be getting obviously historical data so we compare last year or this year to last year, which I think will be helpful. I mean, our budget, I mean, you saw with the expenses, I mean, it's with the supply expenses, it's going to be up all the time because our budget number for dietary, I think, I mean, was incredibly low. So we're learning and we're getting better. And then once we get some historical data and start comparing, you guys will be able to really see, I think, how we're doing going forward. But stats were down. We have to do 2 cost reports. They told you about that, right? So we have switched auditing firms, and the timing of that's not ideal, but we did have a call with CLA, Clifton Larson and Allen, and we have a game plan on how we will do that. And again, to Ide Bailey's credit, they're still talking to us and helping us and working with us. So I mean, until things change or we start getting bills, we're really getting to work with 2 auditing firms at the same time, which is helpful for us. So I think that's, I mean, our big issue, I think, going forward is reducing our reliance on temporary staffing in the long-term care facility. We did some rough numbers, and we'll probably share those with you next time, but we're going to put together a plan for taking what we're paying now and how we could reinvest it in our own people and obviously save money and try to filter it up so we can get ahead of this thing, because we're spending a lot of money on agency nursing. I've talked to Vicky's not as reliant. And then long-term care, I think, has 9. So that's really expensive, and we just, again, that's a focus here internally to start driving that number down. And we'll talk in my report about other things we're trying to do on the expense side of things. So I don't know, any questions? Let's see what else she covered during our meeting. Kendi, you got anything else that she covered? She talked about the audit and the cost report. The CFO update. I talked to Dominique earlier, and I think it's obviously an issue with the USDA. I mean, they obviously want us to have a CFO in place. We're getting some really good candidates in, primarily for the interim position. We have a couple that would like to do the fractional. We have, I think, 3 that would be long-term solutions. We're going to have a call tomorrow or Friday with health tech, and I mean, I think we're kind of tugging at each other, and I think if we work together, I mean, it's more, I think nobody wanted to disappoint anybody, but we realize the urgency to get a CFO in place and the right one sooner than later. And I think our strategy earlier had been get an interim in here and then try to find the perfect place, because this would be a great opportunity for the right person.
So are you leaning towards interim?
Well, I had hoped we could find the permanent, but we don't just want to rely on whoever we can find, because I mean, this is the best place I've ever been to recruit to, so I'm kind of excited to find the right person. And we have a couple of long-term people that would have to transition in. We obviously want the board and health tech involved in our staff, so I think to plug the gap, and having it happen in the summer benefits with a couple of the candidates. They have the summers available to help us, and they would both be really good options. So I would, hopefully by the end of the week, we have a directional thing, and it must be posted somewhere, because we're getting a lot of calls. I had a call last night at 1 o'clock Eastern time, 11 o'clock here. Somebody thought I called him, and then so we had a little conversation, but it wasn't long. But well, we set up an appointment so we could meet in the future. So I'm really confident we'll get a really good CFO. And as important as a CEO is, or a CMO, or a CHRO, or CNO, I think right now where we're at, we need a really good CFO. That's our focus.
Agreed.
Any questions?
Agreed.
And I have a deal with all CFOs here. I do the finance reports when we have profitable months, not when we don't have profitable months. So anyhow, we'll have to get a CFO here, and they can deliver this going forward until we get it turned around in fiscal year 2027. Any other questions?
Okay, thank you. Ashley, any questions from you for Rex regarding finance?
No, ma'am. Thank you.
Okay, thank you, Rex.
Thanks. You got it, Mike.
All right. Next item on the agenda is a health tech report from Dominic.
Thank you very much, Tanya. Just a few things this evening. The first thing is just a reminder about our end of year conference dates for our trustee conference. Just a reminder that is from the 4th to the 7th of October. If you need more information or would like any more information, please do let me know. We have sent out save the dates, etc., and we are busy together. We're busy actually developing the agenda, finalizing our speakers. So that should be done probably in the next 3 weeks or so.
Will you send some information to me?
Absolutely.
Do you know where it is?
Yes, it's going to be in South Florida. And are you?
I think we're all going.
Okay.
Retreat.
Yeah.
We'll have a board retreat.
It's going to be in Fort Lauderdale at the Del Mar Hotel. So it's going to be wonderful. It will be very good. One of the changes that I'm probably going to make this year is, you may remember from our last conference, we have 2 days and then a third day on the Wednesday, which is a half day. But what happens is that a lot of the board members and CEOs and trustees, they end up being out of the office or out of their own positions and jobs and workplaces and that sort of thing, as well as our hospitals. Sort of rolls into approximately 4 days, which is just too much. So we want to ratchet it back by 1 day, because it's a lot of time to be out of your positions or board members or out of the hospital for 4 full business days. So we are going to make a change there. A few other things from a staffing point of view. Rex spoke about the CFO, so I'm not going to go into that at all. I think that we are in a good spot right now with some potentials. I'd wanted to let everybody know, you probably will, you will remember John Freeman, who attended one of the board meetings last month or the month before. He's a VP of finance for us. He's actually resigned his position. He will be leaving Health Tech. He will, however, be staying on in a freelance capacity just for a few months while we find his replacement. So Michelle will still have him to lean on, and I'll make absolutely sure that Michelle gets the support that she needs over this transitional period. Margaret, I'm not sure if you've met Margaret, but she is here. She arrived today. She'll be here until Friday. She's working very closely with Teresa and Mariah. They've been in meetings most of today, and then as well as with the rest of the revenue cycle team, she brings a lot to the table, and I'm very, very pleased to see the 3 of them working so well together. And I, just even overseeing them today, or just watching over them today, I can see they're making very fast ground on a number of items very, very quickly. So I think they're doing a fantastic job there. One thing I would like to mention in that regard, Teresa spoke earlier on, or mentioned the 887K, which is the first car payment to hit the floor. And because there was a holiday on Monday, it was due on the 28th, but it'll probably arrive on the 29th. Obviously, that's going to be a little bit of a celebration for all of us, because it means that we are finally getting through what we need to get through in terms of rev cycle. Rex spoke about the PPS car overlap. I was on the call today with Gretchen as well, and we're hoping we are going to be able to get a breakthrough there very, very soon. We absolutely need to. It's the number 1 item that we need to resolve right now for the hospital. We've spoken a few times in previous board meetings about the ambulance invoices. We've mentioned that quite a few times, but we haven't really circled back to you with specifics and more information. So I spoke to the team today, spoke to Mariah, spoke to Teresa, and we are figuring that there's a rough estimate of somewhere in the region of $2 million there. And we think it's a pretty good estimate. And the RCM team is handling the backlog of that. And the expectation from Teresa and Margaret and Mariah is that that backlog will be taken care of by the 5th of June.
Wow.
So they are hauling to get it out. From a payment point of view, I don't think we should expect anything before probably realistically the end of June. Okay. The fact of the matter is there's 2 million large there. And then moving forward, Amy Speck's team will take over the registration and charge entry in that particular area moving forward. In the very near future, we'll be moving Alreen's team over to full collection activities on Oach and Epic, now that we have taken care of the legacy side of things. The last thing that I wanted to mention is strategic planning. And just as I've been visiting today, spending time today, as well as seeing what's been going on over the last few months and even a few weeks and couple of months, in normal circumstances, I would be introducing Julie, our head of strategic planning, probably in about 6 months' time to the hospital. And I think that where we stand right now, I think there are opportunities that we really need to dig into from a strategic plan point of view. I was just having some discussion today. In fact, it was a discussion with Michelle, and we were talking about moms who are going into Jackson to have their babies delivered, as an example. And this is just one area in particular. You know, we really need to dig into how many moms per year, or how many moms have had babies delivered from a population of approximately 10,000, for example. How many are making the commute to Jackson? How many are we losing? And work out what has taken place over the last year and what potentially could be taking place over the following year. And then what health tech, what we can bring to the table is we can say, okay, well, based on these numbers, this is what we think we need to stand up that department and to make sure that the department actually makes money. Because we've had these situations. For instance, I've just come from a board meeting yesterday at one of our other hospitals. And we have situations where 100 to 120 deliveries per year gives you the potential to actually stand up that department. But what it also does is it also takes away, for example, risk for a potential mom traveling through very, very bad weather to get to another hospital and having to travel 50 or 60 miles in a trip that might normally take a small amount of time, but because of the weather could actually impact, potentially be dangerous for a mom. So I think that, you know, I would like to consider bringing Julie in earlier, and for us to look at, even if it's just a draft strategic plan, even if it's just an initial look, and then from that build out our management action plan and the tactics behind that. But I think that there are so many opportunities that I would like to bring that earlier rather than start later.
I'm very appreciative of that, Dom. I don't know if you noticed it's a topic under new business this evening.
Sorry, I haven't read my agenda correctly. Yeah. My fault.
Yeah, we're bound for some discussion of that later this evening. So I'm glad you brought it up.
Okay, awesome. And that's my update for tonight. Thank you, Board. Thanks, Trustee.
Thank you.
Thank you,
Does
Dom.
anyone have questions for Dom? Okay. Ashley, any questions for Dom?
No,
thanks, Dom.
Okay.
Statistical data just came out this week in regards to OB specialists in Wyoming, and
the maternal desert.
Well, only 1 in 4 of all licensed OB physicians in Wyoming live here.
It's a crisis.
Was really hard to sustain. Like, those departments are closing everywhere, right? I mean,
Well, the malpractice insurance is insane for it too.
Yes.
But only 1 in 4 live in Wyoming. So it's a huge statewide problem.
It's a crisis.
Coupled with the fact that it takes 3 OB physicians to provide maternity care because of the call rotation. It's a challenge.
Could be a prime time to discuss it, though, especially in regard to the Rural Health Transformation Program.
I think so too.
So,
I think it's definitely worth looking at. And yeah, you are absolutely correct. I mean, there's, you know, the OB closures in hospitals has been probably the highest, the biggest service line closure in most hospitals over the last 18 months.
Well, and the other cost, malpractice, if you deliver less babies, your rates are higher. And then nurse anesthetist coverage is expensive. So, but yeah, it'd be a good project to look at for sure.
Yeah. I would like to add that if you begin to study it, look at Sweetwater as well.
Yeah.
Thank you, Dom.
My pleasure.
All right. Next item on the agenda this evening is CEO report. Rex, I'll
So
turn
Dom, I'll
time
go
back over to you.
first next time. That's a tough one to follow. Good job.
Oh.
Well, we'll run through this quickly, and we have subject matter experts here as well, so they can answer questions and present. So, supply chain management. I mean, that's something we talked about during my interview, and I think a huge opportunity for us. Since I used to work at Vizient, which is thankfully our GPO here, so there's a lot of advantages to that. We will be moving our primary distribution to Medline. We've been with Henry Schein, I think. Our markups had been like 30%, and now they'll be down to 1.25%. So there'll be a lot of savings there. And to Henry Schein's credit, full transparency, it was down to 3% last month or so. But and I'd like to at least give acknowledgement to Health Tech. Jeff Hollingsworth, I worked with him at Vizient. He's outstanding, and he's their supply chain leader. So he's been working really well with Mike and our department. So should see some savings there that we'll be factoring into the final budget you see. So there'll be quite a bit of savings there. We're in the process of activating Pyxis and getting our Pyxis machines up and running. I think we found a program through Epic, which hopefully would save us some money as well that we already have access to. So that would save us on our Pyxis monthly fees. So anyhow, I mean, those are some supply chain opportunities I think that we're pursuing. We'll probably also we talked, or Carrie talked a little bit about putting a hold on the assisted living center. Funds have been allocated, but just putting kind of a moratorium pause on things. But we're going to reach out to Vizient and have them not only look at the assisted living center, but also look at the OR and maybe doing a scaled down scope OR, but price in the GPO pricing into the project, because that will make a tremendous amount of difference. Plus, there's an opportunity, and we'll talk with Health Tech about it, but I just know from my previous life in supply chain, when you do building projects, there's an opportunity to garner admin fees as well. So we hopefully will get that done. I mean, I told the foundation it's 30 days. I work better under pressure. So hopefully we have a couple of at least directional documents from up here we can look at and maybe make sure we're making educated decisions on next steps of where we want to go. So keep you posted on that. More to share at the June meeting. Hopefully everything will be done. Mock disaster drill. I've been in a lot of mock disaster drills in my career, and this, quite frankly, was the best. And not only from a standpoint of what went well, but what we learned from that. So Amy is our interim director. I mean, I'd like to echo what Dr. Burnett said. BJ has done an outstanding job here, so he has a nice reference letter ready for him in the morning when he comes by, and because tomorrow's his last day, but he's done a great job. But this mock disaster drill was really well executed, and we learned a lot, and we'll get better even with the next one. So you guys want to come up? With the older ambulances. Two of them.
Either one. Madam Chair, ladies, how are you?
Good, how are you?
Oh, I'm
Great.
fabulous. So
Still sad
first-
we're losing you, BJ.
Yes. I'll get to that in a second since Rex started with the mock disaster drill. It went really, really well. Our hospital and the ER saw 30 patients within about an hour and 45 minutes. And they came up with treatment plans and transfer plans over that hour and 45 minutes or so and did a fantastic job. I shared with the senior leadership team and the incident command team the final after action report. So if you ever get bored and want something to read, I'm sure Rex will be happy to share it with you. I think it's only about 18 or 20 pages, and there's 14 deliverables. And there's really not significant deliverables. It's things that we need to work on for workflows and things of that nature. So it went really well. As far as my last day is tomorrow at 1 o'clock, and excuse me, my notes are here. I had to make a couple of notes. And as many of you know, I've been here for 2 years. I came into an organization, into an EMS team that was struggling and that is now today thriving. We accomplished a great deal of things. We've introduced some new equipment, Hamilton T1 ventilators, Stryker Power Pro 2 stretchers, the new ambulance I was hoping would be here by tomorrow. It's on yet again another delay, so that'll be Amy's kind of first thing coming up hopefully here in the next few weeks. And more importantly, we have introduced evidence-based protocols which improve the care that our community members are receiving. To me, those are the tactile important things, but more importantly, we've created a department that works as a team and is here to provide the best care that they possibly can to our community. I'm proud of this team. I've worked hard with this team. I've worked beside them. I've worked with them, and it's truly been an honor. I've worked in this profession for 24 years, and it has been one of my biggest professional achievements to be here at this district. So tonight, I want to introduce you to Amy Specht. Most of you already know Amy. Amy's been in EMS for about 16 years or so, 13 as a paramedic, 8.5, give or take a few months with this district. For the last 2.5 weeks, Amy has received information by fire hose. I think she's probably waiting for me to leave, so I quit sending her text, emails, messages, and everything else. I trust Amy's leadership, and I believe that we are leaving this organization in this department in a better place than I found it 2 years ago, and I trust Amy's going to continue that moving forward. Thank you all for the opportunity, and it's truly been my pleasure.
Thank you, BJ.
And
Much appreciation for your work here. Sorry, Rick.
No, and you'll still take phone calls, correct? Okay, good. We will miss you, BJ, a lot.
Yes. Best to you,
Amy,
BJ.
you want to say anything or? Okay.
Congratulations, Amy.
So I'll speed the rest of the report up. Provider update. I think you historically have gotten provider updates. Dr. Burnett is correct. You want to do it? What you have here? Well, we'll go through it and you can fill in the gaps. We are really close to having, I guess we have an agreement in principle with an urgent care provider. And so we'll get the those contract provisions or agreement in principle items to Lena, and she can work on the agreement. So that's definitely a positive. And this will be an outstanding person adding to our medical community here. Family practice, we had a meeting with the MEC yesterday, kind of working out women's health versus family practice and primary care stuff. So we'll have more to report next month. But the encouraging news is we have a really good candidate. So we'll be talking about that. And we have Kristen Greenwald here. She was Bill's interim option, maybe longer, but at least interim now for women. So she is here doing her onboarding today and tomorrow, and then she'll start practice next week. I know Barry's working on making sure we're marketing, scheduling things. We put her around and she knows where her office is and her nurse, and I think we'll be ready to practice.
Welcome, Kristen.
Anything you want to say or?
Happy to have you.
I would say.
Yes, thank you. Welcome.
This is a shout out to Danny and Kenyon, Kaylin, that normally our credentialing process takes 60 to 90 days. They got hers done in 19 days. So they told me don't expect it every time. But by getting that done for the credentialing committee, the medical exec to approve, then we can get her on the payer panels quicker as well. So, I mean, it was really a job well done. And I mean, it started with looking at process improvement. We knew how we were doing it. Kaylin and Danny, they put a process chart together, started moving boxes around, and a lot of the inefficiencies were wrung out of the system. So we'll look forward to more of those kind of things going forward. So I think that was really positive. You have the Apogee Hospital arrangement on your agenda later on. I will let you know, and I guess I can share it in open session. We put a pause on the Jackson physician search, retained search agreement for a while until we can determine what we are looking for. I mean, we were paying a flat rate every month. They were willing to pause it, stop our payments to them. Then I really would like to, we talked with the provider community about doing a medical staff strategic plan, which would feed into our strategic plan, community assessment, and everything. We need to know what the numbers are to support certain things, looking at kind of where people are in their practice lives and finding out where to go. And then I think we can make sure we're again using our resources effectively and targeting the right services for the community. So as long as you're okay directionally with that, that's kind of planning on doing. Next item was programs. We'll again go quickly through this, but Michelle mentioned the programs, and these things are all things that opened up because we became a critical access hospital. So the Rural Health Clinic project, actually an agreement was signed by Greg to have Ide Bailey lead this and get us from start to finish. So we have a contract in place on the Rural Health Clinic started. So we're going to start calls next week, I believe. There'll be weekly calls. It's usually a 90-day process, but I mean, things have to happen. And one of my other hospitals started 3 or 4 times, never finished it. So we need to get that finished. That will help. Bill talked, I think, at the last meeting about the financial advantages. It's significant. It's not quite as good as a federally qualified health clinic, but obviously less risk. You have to do a demonstration arrangement with a federally qualified rural health or a federally qualified health clinic where you can actually be approved. And there are some risks with that. Plus, everything's kind of grant based. This will be a lot easier, and this is what most rural hospitals do, critical access hospitals. So we'll get that done. That'll be significant on the revenue side of things. And they used to have a productivity requirement, which I had to get waivers on, and they were wavered for a certain period of time. That's been removed. So we'll help advantageous. Swing bed. We have an agreement in principle. I think you have an agreement you will be looking at with one of the local rehabilitation organizations in town. I have visited another one. We'll do a year deal and then look at how we do things going forward. But this is a program we really need to get up and running. Is to Vicki and her team. This will help us with the long-term care transfer issues and things. So it's really an important program, and the revenue obviously is really good. Plus, most importantly, in town that deserve to be in town, and we get great care here. So this is we want them in our swing bed program. So hopefully, once we now that we have the agreement or we'll get the agreement signed, then we can have the state come out, certify some of the patients in, and get that. 340B program, I hoped we would have it up and running in July. You can do it on a quarterly basis, but I think we've determined you have to have a cost report filed before you can do it. So this probably won't have any much impact on us until third quarter of fiscal year 27. And then we are looking, we talked about Senior Life Solutions. You'll have a presentation next month on that. It's an outpatient geriatric behavioral health program, which helps on the cost report revenue, but it changes lives. So look at that. And then we have other things we're looking at: respiratory, pulmonary, cardiac rehab, wound care, some of those programs. My priority since I've been here have basically been revenue cycle, building project, which you, Madam Chairman, you handled that one. So thanks for doing that. Contract labor, getting a CFO in here, and just for me personally, flattening not only the learning curve, relationship curve with the providers, staff, and everything. So with the Wyoming Hospital Association will be here in June, so we'll let you know they're having a CEO meeting here on site, which is kind of exciting. And we have a call tomorrow if anybody's interested in the rural healthcare transformation funds. Carrie's going to be involved. Some states you got to write a grant. I don't know if you how they're going to distribute the funds. Some states have a formula. They just distributed the funds, 205 million. Or some you have to write a grant to say how you're going to spend the money. Obviously aligned with what Wyoming sent to the federal government. Once the perpetuity piece was gone, I think we were the last state to get ours approved. It's now approved, and we'll have a short time frame for getting either grants written or having the money dispersed to us. So I'm sending out a weekly activity report. Just I think early on, it's just it's helpful knowing what I'm doing, and if I'm doing things incorrectly or not the right direction, let me know. And we talked about process improvements. We do have our second Leadership Institute meeting tomorrow, and so it was well received. So a lot of our department heads are attending that, and just really people in positions in small rural hospitals don't get a lot of leadership training. So it's helpful for me to kind of define how we want to do things. Hopefully, give them some reasons for making the decisions they do. And I think we discussed in the meeting, a lot of people leave their managers. It's not the organization. So obviously, we like the people that we want to work. And then we will be, I'm not sure how this works. I can talk to Lena later, but we have a bunch of beds sitting here and some other equipment that I think, are close to finding a buyer for them. While we get them out of here, some money for this. I did ask the people to report to me directly if they wanted to bring a couple things to your, rather than doing it quarterly, do it monthly so it's not quite so stale. Just the highlights, things they're really focused on until the end. So, Mr. HR guy, do you want to start it? Well, I have to find your notes. This is what I'll have to do. You want to do yours and I'll find it. Well, you're sitting at the head table. You want to go ahead and do yours? You guys.
I don't have much to add to Rex's report other than it's been a very busy month. I think the MEC has met 3 times since the 28th of last month. So we've had a lot of work to do, a lot of credentialing, a lot of issues to address and I think we've done a very good job at tending to those. So other than what Rex said, I don't have anything. Certainly would like to welcome Kristen aboard, look forward to her providing those services that we need, and look forward to working with her.
Before we move on, just because this is part of this discussion, there has been some concern from the board lately with people being able to get in for appointments. And I know we're undergoing some transitions with providers, but can you speak to how, if there are any other ways beyond what you've already discussed, managing that concern?
One
primary
reason I
care,
gave
urgent care.
Shout out to Brian and Dr. McLaren's team in terms of filling in urgent care days in Marvelton, because we have been short-staffed. And by them coming in and providing urgent care services, it frees up our other 2 providers to fill in the slots for primary care. So that's improved. It's my understanding from Ryan that his team will be providing a couple more days of the second week of June so that we can work towards alleviating that problem. So can't say much else than that, other than the team has come together very well, recognizing the shortages and trying to work together to alleviate those.
And working towards some longer term solutions. It seems like that we're just trying to get in place.
Yeah, and with if the contract's approved moving forward with the urgent care provider we have, of course that will fill in a slot in Marvelton for urgent care and may free up one of the providers there to come to Pinedale to do primary care. So we recognize the congestion of the problem and trying to move forward with it as best we can with what we have to work with.
Thank you.
And this individual did primary care, had a regular practice too, and so they're willing to, pinch hit or, fill in where they need to going forward. So hopefully that'll stop some of that. And, this relationship thing, I need to get out with the providers and see what we can do. I mean, my job is to get things out of providers' way so they can take care of people and save lives. If we have bottlenecks or we have inefficiencies, trying to find out where those are, and if there's things that, they didn't feel like could be resolved or fixed to help them see more patients and have better throughput. That's kind of my deal. So we'll work together. And Dr. Burnett certainly, it's great to have somebody like that with his gravitas here that you can rely on to help make that happen. So I think you'll see some improvements in those areas. And we're going to start looking at sharing financial information and just, there are some realities and we just need to kind of look at those and make sure. And most of the providers are driven by stats, and I think you'll see improvement in that area going forward. I'm confident of that.
Okay, thank you.
Good question though. Are you ready?
Sweet. This month, the EMS director panel reviewed many interests and chose 7 that met their criteria that they had set, and HR has been notified to set up second interviews. Nursing has had interviews as well. We have 1 full-time RN and 3 PRN RNs. That's a lot of RNs in there. With offers that we're getting ready to try and get sent out to them. And we are also actively searching for a permanent case manager. Our current locum case manager has indicated she's not interested in relocating to the area for a permanent position. However, she is really willing to remain on assignment to support onboarding and training for a qualified candidate who either currently lives here or is willing to relocate here. And that's all I got. Anything else?
Thank you, Vicki. Question for Vicki?
Thank you.
I think HR, speaking for our Chief Human Resources Officer, they're working on policies, procedures, making sure, being a new hospital, there's just a lot of things to create. So he's been busy with that. We're really paying attention to the recruiting process and how we do that. So we make sure we get back to people that take the time to come in. We're looking at departments that have high turnover rates to see if there's issues, and hopefully, this Leadership Institute will improve some of that. So he's been incredibly busy. They've got revamping the new employee orientation process, so hopefully we start that in June. And then one of their big issues is this human resource information system that I think the decision was made to purchase more ADP stuff, and but it will allow us to schedule and just really be a depository of information, get information out to people, compliance hotline. They'll do a massive amount of stuff for us. So I think people like it. They'll be owning more of their own time and work here, the employees, and then it'll feed into the system. So a lot on that, doing a lot of compliance training, looking at the pay structure here, making sure that it's fair and consistent. He's going to actually, in all of our department head meetings, Raymond will be doing some leadership development too. And I know there's plenty of work to do, and I feel bad for Raymond because if I wasn't this, I'd be an HR person. So I'm not used to teach college courses. So I'm just excited to see where he can take it. He's the right person for the job, and he's got a great team with him. So I think you'll see things in HR not only get stabilized, get some consistency, but I think doing some innovative things in that area going forward. So I think the board will be proud of where HR goes in the next 3, 4, 5 months. Anything you want to add, Raymond? No, unless this doesn't work out. And then every man for himself. No, just joking. So anyhow, that's the report. I don't know, you guys have anything you want to share? Or share? Do you have any questions you'd like to ask so we can share? And again, those weekly reports, let me know what you think. You have the prioritization list. We'll change them every week and let you know. If you have, again, I don't want to get to the end of the year and find out what we were working on wasn't important to you. You're our bosses, so we want to make sure we're doing what you want us to do.
Ashley, any questions from you?
Nope. Thank you, Rex.
Thank you, Ashley.
Rex, I do have a couple of things if you don't mind.
Great.
No, with regards to the swing bed contract, I just wanted to know if Vicki, if Carolyn or Cherie had an opportunity to look over that contract or give you their opinion on it.
Therapy contract?
The swing bed?
The swing bed, we are utilizing Jean, the current case manager,
I
who has
see.
brought up
Okay.
a swing bed program before and has worked with Sherry as well.
Okay, so I just
So,
wanted to make sure she's
yeah.
been actively involved in that.
Yep.
Okay, awesome. Thank you. And then the other thing that I wanted to just mention, which I failed to mention in my update, but it kind of crosses over to Rex's, is Cherie is working with compliance officer training with Christy.
Yes, she is.
Okay, so I just wanted to make sure that you were aware of that because I know that that's going
And I know
on.
Christy really appreciates it and has, gained much from that, from the weekly calls.
Awesome. And then the very last thing, which I also didn't want to lose sight of, I think it's important that we mention this to the board, is I think you have a meeting with Cherie on tomorrow or Friday, Rex, with regards to credentialing. And I think that was a request from the board or part of the board or possibly Lena with regards to the medical team. I know that you're meeting with Cherie on Friday to discuss that.
Dom, just as a correction, I don't think it's credentialing. It's for peer review and quality assurance.
Okay. All right. So I just want to make sure that from our side, we have that straight. I might need to give you a call or just shoot you an email, Lena. Thanks. I just wanted to make sure that you knew that we haven't lost sight of that.
We appreciate that. And everything Health Tech is doing for us, they're filling in a lot of gaps and they're, Johnny on the spot when we have questions, and they're going to do a fair market analysis for us on a project we're working on. So we really appreciate their work.
Thank you.
Rex, just as a point of little bit further discussion, I think for the board regarding surgical services, we were really pushing for surgery several months ago, and then Bill came in and kind of had a little different approach. It took some talking to, but we agreed to move forward with his approach. Now we're kind of doing an about face of fashion. Can you just talk to the board a little bit about your priorities for surgery and why you think that's important that we change direction and kind of move back in that regard?
I think both are important. I mean, there's obviously a continuum of care gap, not having assisted living here in a true assisted living center fashion. I think there's other ways maybe we can do that, and hopefully during the next 30 days we'll come up with other options that don't affect us negatively on the cost report. So again, I think that's really important. I came from a facility that did a building project, not nearly to the extent we did, but they made sure they didn't do any major surgeries, but they certainly were able to do scopes, and had a general surgeon that flew in once or twice a month, did scopes, kept people in the community. It's important for a lot of reasons to have that capability, but it's certainly from a revenue generation standpoint, it definitely helps. So we have, actually, when I gave Kristen the tour, we looked at the OR again. That's a massive space. I think there's an opportunity maybe to just do more of a scope OR room, and then depending on how that goes, then we can look at other opportunities down the road. And if we're doing an OB study, obviously we need to have a more full gamut type of OR. But I think phasing it in is probably the right answer. And I know our friends at Vizient, who were already members through Health Tech, they can help us figure that out and make sure that it makes sense. But I think it's a missing piece here that we really could use. And, every leader you get in here, and you've had a bunch of have different priorities, different approaches. But, I would love to do OB again somewhere down the road. But if we can't, it's really, I think, nice to have scopes, keeps people in the community. You don't have to answer the questions. Okay, well, we'll do the tests here, but you go and just run the risk of having your community peeled off. And I think during the interview we talked about, we don't want anybody to go anywhere else for services we could provide as long as we can cost justify them and the market bears it. And I do think the scopes in a town this size will work. We just need to go back and look at it. And I think we can be innovative about how we make that happen. And it will involve Health Tech in it, but Vizient knows this stuff. And hopefully by looking at GPO pricing, it'll be more, our likelihood of success and being able to cost justify will be a lot greater.
Along those lines, I would just like to mention when I did attend the Wyoming Hospital Association meetings last week, it was a hot topic. I'm sure many of you are aware that part of the early plan was to regionalize surgical services, and that was hotly contested, and rightfully so. You know, it doesn't make sense for people to have to drive to Casper for surgery around here, and so there was a lot of pushback, and I was grateful for that. But I just think it's important to note that at this point when our legislators are trying to decide on how that funding becomes.
Yeah, and thanks for bringing that up. I think the major surgical cases that may be more plausible or might be the push. I think the scopes, hopefully people understand the importance of keeping those in the local community, and we'll just have to see how it plays out. I mean, now that you've hired me, I guess I can share this. HR guy, but when the Critical Access Hospital program first rolled out, I basically left Sidney, Nebraska, because I didn't want to be a critical access hospital. So it's funny how life works out. But that was, I think, the fear back then, is that we were going to just be kind of spokes feeding the hub, and it really hasn't played out that way. But I could see how that will probably resurface again. Trying to economies of scale and efficiencies and those kind of things. But I really don't think the scopes will. I don't think there'll be that push in that area. But we'll keep monitoring closely, and hopefully it all kind of sinks in with the pace at which we're going to look at the future here. So, and you guys have been such an incredible story here with the building and what you've done and the innovation. So I don't want to be coming here as your CEO and not being innovative as well and looking forward. And we'll bring you hopefully ideas that you can look at, and hopefully they're a yes or no kind of decision with the studies that we're doing and the feasibility work we're doing. And I have a great team here, so I have no doubt we'll bring you good ideas you can consider going forward.
Thank you.
Madam Chair, just a couple of comments. I think moving forward, looking at a level 1 type thing, or the first stage type thing, not level 1, of providing outpatient surgical services, much like they do in Rock Springs, to include scopes, maybe dental procedures, ophthalmology, or ENT. And I don't know if you've been to that facility at Red Desert in Rock Springs. It's not a massive facility. It's very modest, but they have a high volume business because they're able to provide those services, which, number one, keep patients close to home, but number two, from a revenue side, there's more money for the organization to be made for the use of the facility than in the charge for the service. So I think it's something worth looking into, not going all in and saying we're going to start out doing general surgery or even joint replacements or whatever else. But I do think it's reasonable to look forward to doing things like colonoscopies or dental procedures or ophthalmology or even ENT. Just my thoughts.
Thank you. I appreciate the discussion.
Well,
I just think it's important how we
we'll keep
frame
looking
the
at assisted living. We can do we can do several projects at the same time, and there's some partnership opportunities, I think, with how we do this surgery going forward. So I'm really excited. Thanks for letting us, I guess, move forward with that and present something to you next month.
Let me remind you, we have done scopes in the Marlton Clinic in the past.
I know.
With minimal facilities. We can do better.
Yeah, I think there's a lot of opportunity. I just think all rural hospitals need to be very vocal right now.
Absolutely.
So, very vocal.
Did you want to say something? Okay.
Okay. Any further questions from? All right. We will move on then. That puts us at the end of leadership reports and into old business. We have one item, which is approval of payroll and bills. This is an action item.
Madam Chair, I would move to approve payroll and bills for the month of April 2026 in the amount of $1,988,257.91.
Okay, thank you, Kenda. We have a motion.
I'll second.
And a second. Are there any questions about anything presented at this time? All right, I'll take that as a no. All in favor of the motion to approve payroll and bills in the stated amount, please say aye.
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 Any opposed? Motion carries. All right, that brings us to new business this evening, of which we have several topics. The first being the draft proposed budget as presented to us by Michelle this evening. And we have a resolution for that draft budget that we have to approve.
Madam Chair, I would move to approve resolution of intent number 7-2026 as presented.
Okay, thank you, Kenda. We have a motion.
Madam Chair, I'll second.
Thank you. Second as well. Are there any questions or points of discussion regarding this draft, the resolution? Okay. Hearing none, I'll ask for a vote on the motion to approve resolution number 7-2026 regarding the draft budget. All those in favor, please say aye.
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 Any opposed? Motion carries. Next item of new business is the rezone application. Board members, you've already been made aware of the town's intent to complete a rezone of the property north of our campus to commercial. This has kind of been in the process for some time, not the process, but in discussion. They wanted to let us finish construction. This has been posted publicly, but they do need for us as a district to formally approve that application and sign off on that for them to begin the public hearing process, which is intended to begin with a first public hearing on Monday. So I will ask if the board has had an opportunity to review that application. And if so, do you have any questions or concerns?
Madam Chair, yes, I did review and I don't currently have any concerns with this.
Okay, thank you, Ashley. Anyone else? Fairly straightforward. If there are no concerns or questions, I would just ask for a formal motion to approve and to approve my signing of the application for submittal.
Madam Chair, I would move to approve the Town of Pinedale rezone application and authorize your signature.
Thank you, Taylor. We have a motion.
I'll second.
A second. Any further comments or concerns? All right, then I will ask for a vote. All those in favor of the motion on the table, please say aye.
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 Any opposed? Motion carries. Thank you. I will get that submitted tomorrow. I think it would be lovely if anyone could be at the public hearing just to answer questions. I cannot be there that evening. I didn't know if, Ashley, you're out of town, I believe, Monday, correct?
I am, yeah.
Okay.
This Monday.
Yeah. It's not necessary, just that
I
I'd
can
see
be
if
there.
you can be there, 5 o'clock? Yep. Okay. I don't anticipate it'll be very long. So. Thank you.
You're welcome.
Okay, next item under new business is the Town of Pinedale Safe Streets for All grant. You may remember last year we did something very similar with the town for a grant. They were applying for the streets and roads in Pinedale. So they have asked us to take part in supporting their efforts to get another grant. And so I have provided that request and just wanted to give the board the opportunity to approve or not approve that. So.
Have you already drafted that letter then, Madam Chair?
Yes, they drafted a suggestion for us.
Oh, okay.
Yeah. And then once we approve it, we just plug in our names essentially.
Okay.
So my question on here is that it says the deadline was yesterday at 9 a.m.
They knew we were meeting tonight, so
Okay.
they
Just wanted
had
to
made
make sure.
arrangements for us to be able to get that in ASAP.
Okay.
Should we be engaged to support it? Yeah.
Exactly. I thought it was the same one initially. Said we just did this. It was like a few months ago, but Chelsea said, no, this is a new one.
Okay, Madam Chair, I would move to approve the submittal of a letter in support for the town of Pinedale and the application of the grant for the Safe Street and Roads for All grant program.
Okay, thank you, Kenda. We have a motion
I'll second.
and a second. Any further questions or concerns?
Can we just receive a copy of that, I guess, when it's sent, just so we know
Absolutely.
what that looks like? Okay,
Yeah,
thank you.
absolutely. It's just a form letter, but I'll send it tomorrow.
Perfect.
Okay. All in favor of the motion to approve signing a letter of support for the town of Pinedale Safe Streets and Roads for All, please say aye.
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 Any opposed? All right, motion carries. Thank you. Next item of business is the Star Valley Health Visiting Provider Contract. I think everyone has been provided that contract. Has this been reviewed legally, I'm assuming? Lena or Rex, has it been signed off on by legal? Okay.
Madam Chair, what was the name of the provider? I don't remember just
It's-
from Star Valley.
I don't think it's a specific provider. It's for visiting.
Boy, I don't recall that, to be honest with you.
And this is the one that you and I worked with Dr. Gonzalez. They added an additional day, changed the credentialing paragraph.
Oh, that was from quite some time ago. You are correct, Jan. We did work on that.
Thank you
So
for
is this
confirming.
the most recent version then that we have with those 3 changes that were made? Okay.
It's okay. There's been so much. Yeah, understood. You just know I'm always going to ask, right? All right, this is an actionable item if the board wishes to move forward.
Madam Chair, I would move to approve. Oh, go ahead, Ashley.
Oh, sorry. I was just going to ask a quick question. So this is just generic. So basically any visiting providers from Star Valley Health?
That's my understanding, correct?
I guess it's just different than what we've been used to seeing, where it's, you know, more specific to specific providers or disciplines. So just curious, is this just to simplify things to kind of cover anybody coming from there? And also just wondering, I guess, like, is there any downside to kind of a
Blanket agreement kind of thing?
Yeah, do you know what I mean? In Star Valley, sending any providers that would compete with any of our providers, if that makes sense, as opposed to specialties that we don't offer.
Would you like to answer that?
I'm sorry, Rex, I can't hear you.
Lena, can you hear me?
I can now.
Okay, sorry. Do you have any thoughts on that? I mean, because normally they are directed towards a specific provider or practice. I don't know if this opens the door.
They are, and I guess I'm a little confused that the board is being asked to approve a generic. I was not under that impression when I'm trying to find it in my emails, but the version that I thought that Jan and I had worked on previously was specific to a provider and was not general, but maybe I misunderstood.
We can definitely go back and revisit it. I don't think it's a pressing issue. I mean, it's just raising the rent, taking the credentialing provision out, and then adding an extra day. So, I mean, I don't think it's that pressing. We'd rather do it right, make sure we aren't creating other issues for the organization.
Do we not have control over the providers they send to us? Like, don't we?
Well, we won't be credentialing now, so you have thoughts on that?
I guess that's my question, is if we're
So
not
it's
credentialing this.
just for clarification, just for clarification, we are credentialing them. We're not requiring that they be a member of the medical staff. So I don't want that to get out that we're not credentialing providers or like ensuring that they are qualified. It's just that we don't have those medical staff requirements.
Does that change our risk, Lena, in approving a blanket type?
I just would not recommend approving a blanket contract. I just wouldn't. I think that it's important for you guys to go through the exercise every time, or at least your admin team to go through that exercise every time in analyzing whether it's someone, you know, as mentioned by Ashley, you don't want to bring in competitors. And that way it's an opportunity to inform the board as well. So I would recommend that you do only provider specific.
And I would agree with that. My understanding was this was just an amendment to provide Dr. Gonzalez specifically an additional day in the office and adjustment to the rent. Of course, I haven't seen the
That was my understanding as well. I just brought up it was Dr. Gonzalez.
Yeah, and I would agree with that we do it on a case-by-case basis so we'll know what they want, who wants to use the clinic and for what type of service.
Okay, so given the discussion, would the board like to table this for some clarification?
Yes.
Okay. Sounds like that is heavily felt like it would be more appropriate. So in order to do that, I would need a formal motion.
Madam Chair, I would move to table the facility use agreement contract with Star Valley Health.
Okay. We have a motion.
Madam Chair, I'll second.
Okay. Any further concerns? Time being? All right, on the motion to table the Star Valley Health contract momentarily, all those in favor, please say aye.
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 Any opposed? Motion carries. Take note of that. Just of note, if this is a timely matter for our admin team, I will be calling a special meeting for next week. So if we need this in a timely fashion to be clarified, we could address it next week if need be. Okay, next item under new business this evening is the proactive contract as it relates to our swing bed and inpatient, I guess, as well.
I believe you have the agreement in front of you. Lena has looked it over. There's been obviously a lot of discussions about it. Certainly very important strategically going forward. They would be good partners, and some adjustments with the fees charged, but certainly it's within line and reason with other places that I've seen. Plus, you know, for us, it allows us to keep patients here and really good revenue stream. In the agreement, Lena has done a really good job of negotiating with Proactive, and our recommendation would be the agreement as presented, and then I think it's for a year duration, and then we will RFP it since we have several providers in the and Proactive understands that.
Okay, thank you, Rex. All right, questions from board members?
I'm sorry, Rex, I heard most of that, but not quite all of it. You said you will RFP it in the future sometime?
Well, this is a year duration, and we
Okay.
talked about everybody. I mean, Proactive has all the modalities we need with speech, occupational therapy, and the band and PT and the bandwidth to perform what we need done to take care of patients on. It has to be 5 days a week straight and holidays and stuff, and so we did get that worked into the contract. So, and this certainly is a nice step to, you know, kind of where we want to be at the end of the year.
Okay. Thank you.
Thank you, Rex. All right. Again, I know we're kind of heavy on contracts this evening, but this is an action item. Get things going for us. So,
Madam Chair, I move to approve the therapy service agreement with Proactive Physical Therapy as presented.
Okay, thank you, Kenda. We have a motion.
I'll second.
and a second. Are there any further questions or concerns before we take a vote? Okay. All those in favor of the motion to approve the proactive therapy services agreement, please say aye.
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 All right. Any opposed? I think we got all three. Motion carries. Okay. Next item is the Apogee, the amendment to the Apogee agreement. Rex, do you want to talk about the changes presented in the amendment?
Yeah, I
just
mean,
briefly?
basically this agreement, I mean, the doctors are paid what they're going to be paid, and there's admin fees on top of, and some other fees, and they're all tied to FTE numbers. And so, and Dr. Burnett did a masterful job at breakfast 3 or 4 Saturdays ago of talking with Dennis. He's also a physician, kind of their outreach person. And they realize the volumes here don't support program, you know, full-blown hospitalist program, and the cost weren't warranted or merited. So they have come up with a reduction based upon the number of FTEs we have, and then there's a reduction, a significant reduction, probably about 12% off the total. I mean, there were some logistical things with changing that out and trying to add our own people, and you know, we had. I mean, I think our plan probably would be to build our own, but right now, I mean, there's a lot of pieces that have to fall into the puzzle before that would be possible right now, and to kind of do a half in, half out thing wasn't. I don't think that was acceptable to Apogee, and plus it created a lot of uncertainties on our end as well. So that's where we've ended. I made a call earlier today, see if there was any other movement. I know Bill had his goal had been to get about a $400,000 savings. We're going to be short of that with the way we've redone this agreement, but it's certainly a savings, and I mean, it can start immediately, and it's significant monthly savings as well. So I think again, it buys us time. We'll be open, transparent with them on kind of our plans and work with them. I've been really worked with a lot of physician groups in our own interest, doing things that normally you would have a hard time doing with kind of a situation like this. I've worked with other ED providers, hospitalists, and they actually, Dr. Burnett approached the subject. Not only were they willing to listen, they had a proposal to us fairly quickly, and we went and tried to negotiate a little bit better deal, and this is kind of where we ended up. So we can still go back to the other plan if that's what the board wants to do, but our recommendation, I think, for administration would be stabilize the arrangement, look forward, make sure we don't have gaps and uncertainties. We're going to rely on residents, I think, to come in, and that can be iffy. I would imagine even more so in the winter here. So we'll keep moving forward with a plan that fits us, but right now this is we've negotiated about as good a deal as we can get. And Dr. Burnett, it was an honor to sit and watch him at work. So he did not the art of the deal, but it was the heart of the deal. He did a good job. So he did an outstanding job. So
Well,
Go ahead.
I'll just say that Dr. Klein from Apogee was a pleasure to work with from physician to physician. He understood our position. He was quite willing to try to accommodate our situation and our needs. I think we came up with something very equitable. I think the change in the contract will probably save the district somewhere in the neighborhood of $275,000 a year. The other thing is, with what Bill had proposed in the future, and I mean the future may be next. Of physicians in mid-levels is going to be certainly a year off. I think with what we've worked out and having 2 hospitalists, with the volume that we have, with having them work 10 on, 10 off, and the other one working the other 10, and we have the advantage of that physician already living in the community. So it was a lot of credit goes to Dr. Klein from Apogee.
Well, I appreciate the work on this in this regard. I was thinking about it, and it's a little bit nerve-wracking to think of changing this contract right as we face our busiest season.
Well, we're
Also,
closing in on a
so-
year
We're-
of renewal too.
Yeah.
So
Yeah.
We're just basically amending it so we can get by with 2 hospitalists instead of 3. I
Right.
think the
Right.
remainder of the rest of the contract pretty much remains the same. But there again, we weren't ready to go into Plan B. We didn't have an alternative plan
Right.
moving forward in September. So I think it was a fortunate situation.
Thank you.
Lena hasn't had a whole lot of time to review the amendment, and I haven't, or addendum. I haven't followed my emails as closely today as I should have. So I don't know if she's fully ready to sign off on it or not. But it's, like Dr. Burnett said, it basically, as long as the rest of the legalese is fine, the deal's fairly simple.
Okay. So what's your recommendation? We approve. Okay.
Is that? Lena, do you have any comment?
Yeah, I'd like an opportunity to speak with you about it. Rex, I don't have any additions or revisions, but I would like an opportunity to speak with you just to make sure that we have addressed whether or not there are any other concerns contained in the contract itself.
Oh, and the bigger.
Does that,
Yeah,
does that make sense?
It does.
Okay. So, do you have a question?
I was just about, I think we're about to ask the same question.
Yeah. Yeah. I'm assuming we want to table this one for just a hot minute.
I think it'd be better. Well, I mean, there's
My thought, you're going to save $20,000 a month, $25,000 a month. This is not an extension of their contract. This is just an amendment to the existing contract.
Yeah.
Can we consider it based on contingent upon legal review? Lena, what would you recommend?
Yeah, you absolutely. And again, Rex and I have not had an opportunity to discuss this one, but if I understood, Madam Chair, your comments earlier, you were going to have a special meeting next week. Would next week be too late?
Oh, I don't think so. And I do know from talking, Dr. Klein? He views this as just, I mean, we can amend going forward with other addendums and other amendments. This one was just to reduce the costs. And then if there's other changes to be made, he said they're certainly willing to look at those. But yeah, next week if we're having a meeting next week, absolutely, that's okay.
Okay.
And we'll find our pace, Lena, together, I promise.
We will, and you've been drinking out of a fire hose, and I fully respect that. If you could give me just a couple of days, Madam Chair, I think that by the time you call the special meeting, we'll be more than willing, or more ready.
Okay. All right. Fair enough. Would the board like to table the motion then, or any other thoughts from board members?
Madam Chair, I would move to table the amendment to the Administrative and Hospitalist Service Agreement.
Okay. We have a motion to table.
I'll second.
And a second. Any further discussion? Question? All right. On the motion to table the Apogee amendment momentarily, all in favor, please say aye.
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 Okay. There's no one to be opposed, so motion carries. Okay. Next item under new business is strategic planning discussion. I asked Rex last week to add this to the agenda for this evening because I feel like we are, I don't want to get ahead of myself, but I feel like we're kind of coming out of a black fog. I feel like we've been in survival mode for 3 solid years, and it feels like we're at a pause for a moment where we can actually start to look to the future, and I think it's really optimistic for us. So this isn't an action item tonight. We just kind of tossed around what the first steps would be. Obviously, Dom's been thinking about this as well, but the one thing that I had thought about that might be a good place to start after everything we've been through is a community needs assessment. So we talked about that a little bit and what that might look like. Might give us a starting point to determine how the community sees the services we provide. It might be an opportunity for education on what we can provide, maybe what we are that they're not yet aware of, things like that. So I just kind of wanted to just start some discussion about, where we go from here. How do we start this process? And if everyone's ready to start this process, it seems like it's time, finally. So
what does a community needs assessment look like then? It sounds like you've already had discussions with somebody or thought about it quite a bit.
no, not at all. It's just something that I've seen done in the past, but it's not been done for quite some time to my knowledge in Sublette. Vicky, have you seen it done? Yeah, it's usually a function of public health or an outside vendor who comes
we
in.
actually have a separate service to do this. You actually do have to do it every 3 years.
Once you're hospital, yeah, I remember that.
So this becomes a real requirement. I think that just in terms of next steps, we'd be very, very happy to just give you an outline of how we do the process. We probably do 2 or 3 assessments every single year. We've just finished 2 hospitals, but there's quite a lot involved. There's a lot of time involved.
Sure.
I definitely would suggest you put together fortunately to say, another steering committee because you will need it.
Mm-hmm.
But we can put together an outline of the process for you, just so that everybody has an understanding of also the time frame. Because normally, you're looking at somewhere around beginning to end, somewhere in the region of about 4 months.
Sure.
It's not quick. There's a lot of interviewing involved. There's a lot of time involved. So, you've got to determine your area. You've got to determine the area that you want to cover. The service area is the terminology. We'd be very happy just to give you an outline of steps anyway, initially.
What are your thoughts and recommendations, Dom? We've never done this before. So is this something that, would this be a good starting point for us? Or do you feel like there are other things that would be take priority?
I think that this would be a great time to start this. I just think that there's so many push and pull forces going on right now, from a very, very top level. There's a lot going on, as you know, at the government level with regards to, cuts, changes, tariffs. We're currently trying to get money back for our hospitals and tariffs, like all the other companies in America, because they should be getting their money back. That's a slightly different topic, obviously, but I think that because of the amount of time involved, I think the earlier that you start, the better. And especially if you, as you just said earlier on, if everybody's feeling like they've just come out of this black fog, or and you're just starting to get some traction, then your service lines and your offering, lining that up with what the community is looking for and what they need, and even if it's just what they're communicating in a very informal manner, I just think it's worthwhile just getting it out of the gate. Yeah.
And if I recall correctly, we actually talked about this at the conference last fall.
Yeah.
We talked about that would need to be like kind of the first step of the strategic planning, just because we haven't done one yet.
Yeah.
So I remember us talking about that at the conference.
How do you feel, Rex?
So you guys can do the community needs assessment too, or help?
Oh, yeah.
Okay.
Yeah.
Yeah, I think, going through the interview process, that's the first thing you go to with most hospitals, is find out what the community needs are. And there are similar concerns in every community. I think it'd be nice to know how we are different here. And you get a brand new hospital, this would be the time to make sure we're meeting those needs in some fashion and working on a meaningful project to improve the health of the community. And it does feed into the strategic plan, as does that medical staff strategic plan stuff. It all kind of feeds in together and get the community involved in it and make it not only ours but theirs as well. I think it is the right time to move forward. I didn't know you guys did that. That's good news though. So there are companies out there, and if we're already engaged, that makes total sense. And I know Carrie, I think's done maybe more of an informal one, so it'd be a good experience, for her in the community. I would think.
So it'd really be pretty easy for me to just give you the outline of the steps involved so that the board has an understanding of what's involved, the specifics, timeline, and the different phases. No problem at all.
Could you bring that to us for next month's meeting?
Yeah, no problem. I can get it to you before then.
Okay.
Yeah.
Thank you.
I know Ashley at the foundation meeting brought up the need for strategic planning too. And so I think you guys are all thinking the same thing at the same time, which is exactly what you want. So.
Yeah, it's time. Does anyone else have any thoughts to add?
Nope.
Ashley?
We're in the right direction.
Maybe just if we keep it on the agenda for next month and maybe plan to establish that committee once we have kind of that path forward from Dom. I don't know what you guys think about that, but.
Yep, that would be my intent, probably to leave it on the agenda for the next several months as we figure out how we move forward.
I'll make sure I get something through to you early enough that you've got plenty of time to review it before the next board meeting.
Well, and I think we talked about doing workshops because we talked about doing workshops for this, and then we also talked about it in regards to the DOA, like looking ahead. And I think we could tie the two workshops together.
Okay. Anyone else have anything to add?
That's exciting. It really is.
Yeah, it feels refreshing just to take a step back for a moment and think, okay, now what we got through today and tomorrow and what comes next.
And the revenue cycle will be fixed by then, right, Teresa? She's back to work. That's what we want. She's already after it again.
Okay. Any further
It
thoughts?
will be. Yes, exactly.
Okay. Last item under new business is FOIA requests, of which we have none. So at this point in time, that concludes our business. In open session, we do have matters of all of the executive topics, personnel, real estate, contracts, and legal, I believe, to discuss in executive. So if I could get a motion to enter into executive for those specific purposes, we'd appreciate it and thank everyone for their time.
Madam Chair, I would move to go into executive session for the purpose of discussing personnel, real estate, contracts, and legal.
Okay, thank you, Kenda.
I'll second.
A motion and a second. All in favor, please say aye.
Aye.
All right, motion carries. Thanks, everyone.
Do I have?
Yes, do a quick fit.
You want our leadership team to stay or do you want them to go? Yeah, I think. Don't give me that look. I think you're okay, but I think Dr. Burnett would be helpful.